Okay, so AI is completely changing the game in medicine, right? It's promising to help us spot diseases way earlier and create treatments just for you. But there's a pretty big catch. A hidden danger, actually, lurking inside these amazing algorithms. And it's a danger that could actually make health inequality worse. So just how big of a deal is this?
I mean, really think about that for a second. Could an algorithm, a piece of code, actually deny you the medical care you need? It sounds like science fiction, but it's a very real question we have to ask, because the same AI that's supposed to help us, well, if we're not super careful, it can end up packed with hidden biases, and those biases can lead to some really unfair outcomes and cause actual physical harm. So let's get into how this actually works.
So, first up, AI's double-edged sword. Look, there's no doubt AI is an incredible tool. I mean, it can process just mountains of data to help doctors make better decisions. But that exact power, that's also what makes it risky. And that risk has a name: algorithmic bias. And here's the absolute key to understanding this whole thing. AI isn't some neutral, objective robot. Nope. An algorithm is only as smart or as fair as the data we feed it. So if the data we give it is already tainted with our own human biases about healthcare, guess what? The AI doesn't just learn those biases, it can actually make them bigger. And this isn't just a theory. We're talking about real, measurable harm.
Okay, so let's move from theory to reality. How does this bias actually show up in a hospital? Well, there's a pretty famous case study that gives us a perfect, if kind of scary example of a well-meaning algorithm getting it all wrong.
So here's what happened. An algorithm was built to find the sickest patients so they could get extra care. A great idea, right? And to figure out who was sickest, the AI looked at how much money they had spent on healthcare in the past. On the surface, that makes sense. You know, the more you spend, the sicker you probably are. But that simple, logical-sounding idea, that's exactly where the problem started. And the result was, honestly, devastating. See, due to a whole bunch of systemic issues, Black patients on average spend less money on healthcare than white patients, even when they are just as sick. The algorithm couldn't see the sickness. It could only see the dollar signs. And because of that blind spot, it was predicted to slash the number of Black patients getting flagged for extra care by more than half. Just let that sink in.
And like Dr. Raj Ratwani points out, this isn't just a number on a spreadsheet. We're talking about real people not getting the care they desperately need, which can lead to serious and totally preventable harm. And a danger this big, well, it finally got the attention of the people in charge.
Which brings us to our next part, a mandate for fairness. Yeah, because of stories just like that one, the government has finally stepped in. And they've issued a new rule that basically puts the entire healthcare industry on notice. This isn't a gentle suggestion, it's a deadline. Okay, so here's the timeline. Back in April 2024, the Department of Health and Human Services, or HHS, dropped a new rule. It flat-out prohibits discrimination that comes from these AI decision-making tools. And get this, the deadline to comply is early 2025. That gives facilities just 300 days to figure this all out. That is a ton of pressure, and frankly, it shines a big spotlight on a major problem.
And that problem is something we can call the implementation gap. Think about it. Huge, wealthy hospital systems, they can probably hire a team to check all their AI for bias. But what about the smaller community hospitals, the ones that are already stretched thin? They're stuck in a terrible spot. Either they don't use new AI that could actually save lives, or they use it and just cross their fingers that it isn't biased. Either way, health inequities could get even wider.
So that leads to the million-dollar question, right? Who is actually responsible for fixing this mess? Is it the company that makes the AI? The hospital that buys it? The government that's supposed to be overseeing everything? Who's on the hook?
Well, the thing is, it can't just be one of them. The only way this works is with a model of shared responsibility. This problem is too big for any one group to tackle alone. Everyone has to be involved.
The best way to think about it is like a three-legged stool. You've got three essential pillars holding everything up. First, the healthcare facilities, the doctors and nurses on the ground. Second, the AI developers, the people actually building these tools. And third, the regulatory bodies, the government agencies making the rules. You take away any one of those legs and the whole thing comes crashing down. It's that simple.
Okay, so shared responsibility sounds good, but what does that actually look like? How do we make it happen? Well, the good news is we're not starting from scratch. There's actually a pretty solid 5-step blueprint for putting this all into action.
All right, let's walk through this blueprint. Step 1 is all about transparency.
Developers have to open up the black box and show us their data and how they tested their AI. Step 2, alignment. All the government agencies, like the FDA and others, need to be on the same page with the rules. Step 3, we need clear standards. HHS has to lay out exactly what fair looks like and how to measure it. Step 4, and this one's huge, deploy free or cheap tools. This way, all hospitals, especially the smaller ones, can actually afford to test for bias. And finally, Step 5, create assurance labs. Think of these as certification centers that give AI a stamp of approval, so hospitals know a tool has been checked for safety and fairness.
So when you boil it all down, the main point is this. A fair, equitable future for AI in medicine is not just going to happen on its own. We can't just hope for the best. If we really want to protect patients, it's going to take intentional, coordinated work from every single one of those partners we just talked about.
So, here we are. We've got a blueprint, we've got a deadline, the clock is officially ticking. The question isn't if we should do something about this anymore. The only question left is how are we going to come together and make sure that AI in medicine fulfills its incredible promise to heal everyone equally.